Hi, my name is Dr. Carmen Izquierdo. I am a board certified family physician and geriatrician, and today we're going to talk about the science behind multivitamins. Should we really be taking them daily? Now, this is an important question. So, one common myth is that everyone should take them daily. Now, this is not true, and the science backs it up. There are large randomized trials that show only modest benefits with no significant reduction on mortality or cardiovascular disease. So, for most healthy adults, if you're eating a balanced diet, if you're not skipping meals, you don't have any dietary restrictions, then you might not need multivitamins. Myth number two is that multivitamins boost energy. Now, this is false. They don't actually provide energy unless you have an identified nutritional deficiency. The most common finding that we see in the adult population, particularly the geriatric population, is vitamin B12 deficiency or anemia. When you have low blood levels of iron, folate, or B12, you can have lower hemoglobin, and that can lead to feelings of fatigue or low energy. So if you are within these targeted patient populations, then multivitamins will make you feel better because they're actually replacing a dietary need that you're not getting. So only in these individuals you can actually see a clinical benefit, but in the general population, again, if you have a balanced diet, then you might not feel any type of difference. So again, no consistent benefit on nourished individuals. Number three is the myth that they prevent chronic disease. Now, this has been debated for a long time, but according to the U.S. Preventive Service Task Force, there is insufficient evidence to recommend daily use for prevention of cancer, cardiovascular disease, or chronic illness. So it's not a proven health prevention tool. Now, there are caveats, and we're going to talk about them at the end of the conference, but just hang in there with the 5 myths. Number 4 is that more vitamins equals better health, and this is something that I see a lot, especially nowadays, where you even get promoted supplements on TikTok, on YouTube, on the social media trends, and it's very important that number one, they are not regulated. You can have different types of combinations and doses higher than the daily recommended value. And there are certain vitamins which can lead to toxicity, and this is called hypervitaminosis. And it is important. I have seen cases of hypervitaminosis in older adults, and they are dangerous. I'm going to talk about 4 vitamins in particular that really can have dangerous effects. For example, vitamin A or hypervitaminosis A can cause liver damage, blurred vision, bone pain, and skin changes. High levels of vitamin D. Now, this is a common one I see because they usually are taking a multivitamin plus their physicians supplements an additional dose, or they buy it over the counter, and when you add up all of the units that they're taking, it can lead to accumulation and toxic effects. Now, high vitamin D levels can become toxic, and we see them. You can have high calcium levels, dehydration, vomiting, and kidney damage, and this is very dangerous. I even had a patient hospitalized once due to this. Now, hypervitaminosis E, it's also dangerous, especially if you're taking blood thinners. This can lead to increased bleeding risk. It can affect platelet aggregation and even increase your stroke risk. So again, not more. More is not always better, and high doses of certain vitamins can be dangerous. Myth number 5 is that they replace a healthy diet. So this is a very complex topic because nutrients don't act alone. For example, I cannot recreate all of the health benefits I get from eating an orange, which is high in vitamin C, but an orange also has fiber and it has other ingredients and nutrients that I really can't replicate when I am supplementing vitamin C alone in a pill. So whole foods provide fiber, phytochemicals, and other nutrients that are more available in your bloodstream and that are absorbed better and at a more slow or steady rate than when I'm taking a high dose of a pill, which has to, go through a different process for the ingredient to become available in your bloodstream. So there is a difference there. And again, supplements alone cannot really replicate the complexity of real food. And this is something that is very important. So when are multivitamins beneficial? I love them, don't get me wrong, and I use them on my patients, but it's a risk versus benefit analysis. If you're at end of life, if you're taking more than 15 pills and you want to cut back on some, then this is an analysis that we do, patient by patient. Is it truly necessary or not? That is the question. So what are some individuals that really need multivitamin supplementation? The first example is pregnant women or women in reproductive age. Now we need to supplement folate to avoid neural tube defects. So this is a very targeted population that has a benefit from the multivitamins. If we have a vitamin D deficiency, supplementation is key. And obviously as we age, many of us are going to become deficient and we really require them for bone health. But again, there should be a targeted dose. We need to be careful and test our blood levels periodically to address rule out toxicity. B12 replacement, again, in people who are vegan, who are not getting enough sources of red meats, then B12 supplementation is key. If you have any of the deficiency anemias in iron, folate, or B12, then again, it's essential because we need it for formation of the red blood cells. And in certain medical conditions, we do use high doses of supplements, and I'm going to talk about a few of them. These include malabsorption syndromes, people with bariatric surgery. People on certain medications like metformin can have B12 deficiency. Extreme dieting, again, I see this in the geriatric population. They eat only once per day. Then again, I'm going to have to need to supplement with multivitamins to really ensure that they're getting everything they need nutritionally and metabolically. Wound healing, we usually use higher doses of certain nutrients to support wound healing. So again, there are certain patients who benefit from them, but it's not a one-size-fits-all rule, and I can't take 10 or 15 supplements at the same time without consulting a doctor because there are serious risks involved. So thank you for joining in, and please remember to share this video with someone who benefits from this clarification. Stay tuned for other wellness myths debunked, and if you have any other great topic ideas, please comment in the chat. Thank you.